Picture this. You're the very first person to arrive at a medical crisis. The clock is ticking, your adrenaline is absolutely pumping, and a life is literally on the line. So, what happens next? Well, welcome to this explainer where we're going to break down the exact sequence of events that takes a sudden, chaotic situation and turns it into a highly controlled, life-saving mission. Today, we're focusing on the emergency response process. We are going to break down the vital steps of an emergency rescue in plain, everyday English. And to make this really practical and honestly just easier to follow, we're going to trace the journey of a hypothetical patient. Let's call him Thomas. We'll follow Thomas from the exact moment an emergency strikes, right up to the second he's handed over to the hospital staff. Okay, let's dive into this. Here is the structured protocol we'll be walking through today. First, the first critical moments. Then, the A, B, C, D, E assessment, calling for backup, immediate care and monitoring, and finally, transport and handoff. Phase 1, the first critical moments, recognizing the emergency and ensuring safety. Believe it or not, saving a life actually starts before you even lay a single finger on the patient. Before you rush over to help Thomas, you have to perform what emergency responders call a scene size up. The absolute golden rule here, ensuring scene safety. You've got to evaluate the area for hazards, whether that's oncoming traffic, a fire, a chemical spill, or maybe unstable structures. Why? Well, because you absolutely cannot help Thomas if you become a casualty yourself. Safety always comes first. Right, so once the scene is completely safe, you approach. Now, how do you recognize if it's actually a life-threatening emergency? You use the shake and shout method. You gently shake Thomas's shoulders and ask really loudly, "Are you okay?" If you don't get a response, you need to check for signs of life. You spend no more than 10 seconds doing 3 specific things: looking for chest wall movement, listening for breathing, and feeling for air on your cheek. If nothing is happening there, you know for sure you have a severe crisis on your hands. Let's move to phase 2 and see how this builds, the ABCDE assessment, finding the problem. The ABCDE framework stands for airway, breathing, circulation, disability, and exposure. Emergency medical technicians, or EMTs, use this as a super rapid, step-by-step checklist to identify and treat immediately life-threatening conditions. And it's a prioritized list, which means you do not move on to B until A is totally secured. Let's translate those first 2 letters into everyday language. A is for airway. Now, if our patient, Thomas, is talking to you or crying out in pain, that's actually a great sign. It means his airway is open. But if you hear a high-pitched sound, that's known as stridor, or if you hear snoring or gurgling, there might be a severe block. Then, B is for breathing. You're looking for that chest movement and feeling for breath. If he isn't breathing properly, oxygen just isn't getting to the brain. And that is an immediate, critical problem that requires fast intervention, like an oxygen mask. Okay, now let's look at C, D, and E. C is circulation. Here, you check a central pulse, like the carotid pulse right in the neck, and look really closely for any severe bleeding. D stands for disability, which honestly just means assessing their mental state or level of consciousness. You know, are they alert, confused, or totally unresponsive? Finally, E is exposure. This means safely exposing the patient's skin, maybe by cutting away clothing, so you can look for hidden trauma, a hidden bleed, or medical clues like a weird rash or extreme temperature changes. Phase 3, calling for backup, getting the right help. Recognizing the emergency and figuring out the core problem is vital, obviously, but you cannot do it alone. When calling for help, professionals use the methane protocol, and this brilliantly illustrates exactly what you need to tell an emergency medical dispatcher. You have to give precise, actionable info. What's the exact location? What's the type of incident? Are there remaining hazards? How do responders actually get access? How many casualties are there, and what emergency services are required? Providing this clear, structured information makes sure the dispatcher sends the right backup with the right gear directly to Thomas. Phase 4, immediate care and monitoring, taking action. So the crucial point is, with help on the way, the story shifts to providing immediate care based on Thomas's specific condition. This is where active physical interventions happen. If Thomas was totally unresponsive and showed 0 signs of life during our initial check, CPR begins immediately. The standard protocol for adults is a rigid ratio of 30 chest compressions followed by 2 breaths. EMTs aim for a rate of 100 compressions a minute, pushing down 4 to 5 centimeters on the lower half of the sternum. This manual pumping is literally what keeps oxygenated blood flowing to the brain until advanced help or a defibrillator arrives. Now, let's say Thomas is actually breathing and stabilized. The care doesn't just stop, it shifts to continuous monitoring. Once the EMTs arrive, they're going to attach tools like a blood pressure cuff, cardiac monitors to check his heart rhythm, and a pulse oximeter. A pulse oximeter usually just clips right onto the finger to measure the oxygen saturation in the blood. Reassessing these vital signs continuously is absolutely essential because, a patient's condition can change in a flash, and responders have to be ready to adapt their treatment right on the fly.
Phase 5, Transport and Handoff, the final link. Now, what's really interesting about this is that we are now inside the back of the ambulance. And let me tell you, this isn't just a taxi ride to the hospital. It's practically a mobile emergency room. You've got the stretcher where Thomas is completely secured, the oxygen tanks, and continuous monitoring equipment lining the walls. En route to the hospital, the EMTs don't just sit there waiting. They are constantly reevaluating his ABCDEs, giving fluids if necessary, managing his pain, and doing everything to keep him alive and stable.
While on the way, or immediately upon arrival, documentation is a critical step that simply cannot be overlooked. EMTs will fill out a patient care report or a PCR. If he's conscious, they'll ask Thomas for his personal details: his name, age, address, any allergies, and his medical history. This PCR formally documents all his vital signs and the exact immediate care he received back at the scene. This guarantees a seamless medical handover, meaning the emergency room doctors know exactly what happened, what treatments have been given, and what to do next without losing a single precious second. So to bring this whole thing together, here's a quick recap of the entire 8-step journey. First, you ensure scene safety and recognize the emergency using Shake and Shout. Then you perform the rapid ABCDE primary survey. Next, you call for the exact right backup using a protocol like methine. You provide immediate life-saving care based on their condition, continuously monitor their vital signs, and finally, you safely transport and formally document everything for that hospital handover. This structured, methodical process is exactly what transforms a chaotic, terrifying crisis into a highly controlled, life-saving mission. We followed Thomas from the incredibly scary first moments of a medical crisis all the way to his safe arrival at the hospital, all thanks to this highly organized sequence of actions. So now that you know these critical steps, are you ready to be that vital first link in the chain of survival if an emergency happens around you? Think about it. Understanding this process could literally save a life. Thank you so much for joining me for this explainer, and as always, stay curious.